Spotting in early pregnancy, when it's normal versus when to worry. Most women think any bleeding in early pregnancy means something is wrong. Let me be very clear. Not all spotting in pregnancy is dangerous, but ignoring the type of bleeding can be. If you have searched spotting in early pregnancy, light bleeding during pregnancy, first trimester, or is spotting normal in pregnancy, this is exactly what you need to understand. Here's what most people don't know. In early pregnancy, your uterus is like a freshly planted seedbed. The embryo is attaching, tiny blood vessels are forming, and this process can sometimes cause light spotting. Think of it like this. When a plant takes root, the soil shifts slightly. That small disturbance can show up as a light pink or a brown discharge. That's often normal. But wait, this is where people go wrong. They treat all bleeding the same or worse. They ignore it completely and both can be risky. So, how do you tell the difference? Let's make this very simple. Normal spotting usually looks like this: light pink or brown in color, very minimal, just stains, not flow. Last only for few hours to 1 to 2 days, no severe pain. It's more like spotting, not bleeding. But let me stop you here. Warning signs look different. Bright red bleeding, flow similar to the period clots, cramping that feels like tightening waves in your lower abdomen, your body asking for attention, not waiting. And this might surprise you. Sometimes the problem is not inside the uterus. It could be something like cervical sensitivity, especially after intercourse or a scan, which is why guessing at home is not helpful. Now let's talk about what's actually happening in your body. In the first trimester, your hormone levels are rising rapidly. The lining of the uterus becomes thick and reaching blood supply. At the same time, the embryo is embedding deeper into that lining. This process can cause minor vessel breakage, leading to spotting. But in certain cases, like a threatened miscarriage or ectopic pregnancy, bleeding pattern is very different. These are general patterns, not guarantees. Here, what I see very often: a woman notices slight spotting and immediately assumes the worst. That fear builds up fast. I did something wrong. Is my pregnancy at risk? That anxiety is real, but reacting blindly doesn't help. Understanding does. So, let me give you clear actions you should take first. Do not panic. Do not self medicate. No random tablets, no home remedies. Second, track the bleeding. Notice the color, the quantity, and how long it lasts. This information helps your doctor to decide quickly. Third, reduce physical strain temporarily. Avoid high impact activity. Give your body a little rest, not complete bed rest unless advised. But wait, there's one more important step. Inform your doctor early. Don't wait for it to get worse. Even if it turns out to be normal, early communication gives clarity. Now, let me be very clear about when you should not wait. If you have heavy bleeding like periods, severe abdominal pain or cramping, dizziness or fainting, bleeding with clots, you need medical attention immediately. This is not the time to observe, this is the time to act. Here's the reframe most people need to hear. Spotting is not always a problem, but your response to it became one. Ignoring it creates delay, overreacting creates panic, but informed action creates safety. And from a medical side, when you come in with the spotting, we don't guess. We do an ultrasound to check the pregnancy location and a heartbeat. We may check your hormone levels. We assess your cervix and bleeding source, and based on that, we guide you step by step. If you remember just one thing, goal is not to avoid spotting, goal is to understand what your body is telling you. Because in early pregnancy, it's not the symptom alone that matters, it's how quickly and correctly you respond to it. Every pregnancy is unique. You have a question or a concern, consult the maternity experts at Cloudnine. Book your appointment today for trusted personalized pregnancy care.